To Atlanta, man, I'm going to get right, man. I'm going to get with some specialists, see what's wrong with my heart, bro. It's my heart, bro. They say I got a left atrial enlargement in my
atrium. Atrial. Oh my God. Okay, let's continue.
heart, a left atrial enlargement in my heart. I'm just going to get my body right, bro. Rest. Going to see a heart doctor and shit.
Bro, if it's already enlarged, there's nothing you can, you know what, come on.
I just go home every night. I've been going to the hotel every night, just put a cold towel on my chest and go to sleep.
A cold towel on his chest. Okay, you know, let's see what this nigga's going through. Listen, I don't want to sound callous and unfeeling and uncaring, but I don't give a damn about this dude. Like, he's caused too much nonsense online to be. Anywho, let me see what's wrong with this nigga. Heart issues. Okay, he has a left atrial. Atrial. This nigga said atrial. Ah, no. Okay. Left atrial enlargement. Shared that he's struggling to breathe and has been experiencing chest pains. Okay. Lil Boosie expressed frustration with Atlanta hospitals for not taking his concerns seriously after a car crash. Sir, you should have went to Piedmont. Okay. Let's see what happens with the left atrial enlargement. How bad is that? Left atrial. There we go. How bad is it? It occurs when the left atrium, one of the heart's 4 chambers, is larger than it should be. Often a sign of underlying heart conditions, especially those that increase pressure or volume within the left atrium. LAEs can be mild, moderate, or severe, and its size can be a predictor of cardiovascular events and mortality. High blood pressure can put a strain on the left atrium. Mitral valve problems, issues with the mitral valve like stenosis or regurgitation, can cause the left atrium to work harder and enlarge. Left ventricular dysfunction, the heart's main pumping chamber, can lead to increased pressure in the left atrium, resulting in enlargement. Congenital heart defects can also contribute to LAE. Other conditions: atrial fibrillation, aortic stenosis, left atrial tumors. Okay. So, often detected through imaging tests like echocardiograms, which can measure the size and function of the heart's chambers. Electrocardiograms can also provide clues about atrial enlargement. Treatments involve medications for high blood pressure, valve repair or replacement. Shit. God damn it. Or other interventions depending on the specific condition. Prognosis and complications. LAE can be a sign of a serious cardiovascular conditions and associated with an increase of risk of stroke. Goddamn. Atrial fibrillation and other heart problems. Treatment of the underlying condition is crucial to prevent or slow the progression of these complications. Then you're talking about valve replacement. That is not the bee's knees, y'all. That is not the bee's knees.
In this radiology tutorial, we are going to learn how to recognise left atrial enlargement on chest radiographs. While assessment of cardiac chamber size and function is most practically assessed with echocardiography, the sheer number of chest x-rays performed means that it remains important to be able to confidently identify left atrial enlargement on radiography. As you can see, this patient has received a mitral valve replacement, but the effects of their prior mitral disease on the left atrium remain evident. We are going to compare with this normal chest x-ray. You will hopefully recall that the right heart border is formed by the right atrium, the inferior border by the right ventricle, and the left border primarily by the left ventricle. The left atrium is located posteriorly, and only the atrial appendage component is visible on a normal frontal projection.
Oh, I see.
However, when the atrium becomes enlarged, its right aspect may become directly visible as an extra shadow paralleling the right heart border. This is known as the double density sign, or the double right heart border sign of left atrial enlargement. If we look at this normal CT for correlation, you can see the posterior location of the left atrium. Here is the left ventricle, the right ventricle, and the right atrium, where there is mixing of contrast arriving from the SVC with non-opacified blood from the IVC. The edge interface between the right atrium and the air within the right middle lobe is responsible for the normal heart water seen on frontal radiographs. As you can see, the left atrium does not project out into the lung, and therefore will not be visible on frontal radiography. If we switch to this patient, who has mild left atrial enlargement due to the presence of an atrial myxoma, we can see how the atrium begins to project laterally into the lung as it enlarges. This creates a discrete edge interface visible on frontal radiographs and explains the origin of the double density sign. If the double density sign is present, then the oblique left atrial measurement can be taken between the outer edge of the atrium to the midpoint of the left main bronchus. A distance of greater than 7 centimeters confirms left atrial enlargement. The main bronchi themselves can also be used to assess left atrial enlargement.
Okay.
As the left atrium dilates, it causes splaying or widening of the carina. An angle of greater than 90 degrees is considered a sign of left atrial enlargement. As you can see in our normal patient, the carinal angle is nowhere near 90 degrees. The final sign of left atrial enlargement we'll be discussing on the frontal radiograph is bulging of the left atrial appendage. Normally, the left atrial appendage contributes to a flat or slightly concave upper aspect of the left heart border. When enlarged, however, the left atrial appendage creates a discrete convex bump. For completeness, here is what left atrial enlargement looks like on a lateral radiograph. The left atrium forms the posterior heart border. Here is our normal case.
Easy, Pete.
And here is a case of gross left atrial enlargement, which bulges posteriorly. For further illustration, here again is our patient with left atrial enlargement due to a myxoma. So hopefully now you'll be able to confidently identify left atrial enlargement on chest radiographs by looking for the double.
Okay. Yeah, little Boosie. Listen, yeah, like y'all said, all that money, it means nothing. How old is little Boosie? How old is this nigga? He's only 42 years. Oh my gosh. Okay. Yeah, and he has diabetes. And he has diabetes. And he, listen. There's a guy that lives in North Carolina. He's 36 years old. He's pre-diabetic. Okay, I just had to do that. Anywho, Boosie is 42 years old with diabetes and left atrial enlargement. Money means nothing. All the money in jewels, all the cars mean nothing. And I hate that it takes stuff like this to put things in its proper perspective. You know, what's the saying goes, when a man is sick, he only wants one thing. Oh, when a man is poor, he wants many things, but when a man is sick, he only wants one thing. Yeah. No, baby, he that nigga 42. That nigga only 42. He was born in 1982. That boy looking like he fitted too. All right. He doesn't take care of himself. Why should I feel bad? He doesn't take care of himself. You can afford to, chef, dietitian, nutritionist. You can afford all that. Why should I feel bad for this guy? I don't. Yeah, man. People playing around. Yeah. When a man is poor, he wants many things. When a man is sick, he only wants one thing. Yes. Yeah. I don't feel bad for Boosie. I'm sorry. You got the money to fix this. At least part of your health condition. No, I don't feel bad for this dude.